Hi guys, it's Catherine, and today I'm going to be discussing pulmonary embolism and infarction. So, an embolus is a clot formation. And generally what happens when we're referring to pulmonary embolism is that there's an embolus that is blocking a pulmonary blood vessel or the pulmonary artery. And a lot of times what will happen is that embolus will start in the lower extremity. So a patient will have an embolus in their leg, it gets dislodged and travels to the lungs and can cause a pulmonary infarction. And if we remember from the heart chapter, a myocardial infarction is when an area of the heart is deprived of oxygen and it can lead to cell death over time. It's the same for pulmonary infarctions. So if you have an embolus that is blocking the blood flow to a particular area of the lungs, it will lead to cell death over time because of that lack of oxygen, and that's what an infarction is. So the tissue may recover if it is not affected for too long, but if it is deprived of oxygen for a long time, it can become necrotic and die. A total lung infarction is very rare. Usually a saddle embolus, which is a large one, becomes lodged in the pulmonary artery and completely occludes the vessel and blocks any oxygen from getting to the entire lung. Patients with this type of pulmonary infarction are at a much, much higher risk of death. If it's not caught quickly, then that patient will die because they're not able to get oxygen to their lungs, which then means they're not able to get oxygen as well to their heart, and that's a very dangerous situation to be in. Generally, though, a pulmonary infarction will just be in a small area of the lungs due to a small embolus that is blocking the blood flow to one of the bronchi, and then therefore just that area of the lung will be affected. Like I said, early diagnosis is key to a good outcome. Generally, patients with a small pulmonary infarction, just an area, have a pretty good outcome for recovering from that, as long as it's found quickly. So what are the contributing factors? So some of the very obvious ones are things such as a sedentary lifestyle, obesity, smoking, and being over the age of 60. So pretty much like a lot of our other conditions, those are very common factors that can result in someone developing an embolus. Pulmonary embolism is also a serious complication of DVT. So if you have a patient who has deep vein thrombosis, then it's important to be aware of their risk of developing an embolus that can lead to a pulmonary infarction. And oftentimes this will happen after surgery, from them, just resting, and they can develop a blood clot that way, and then oftentimes that blood clot can be dislodged during physical therapy. And so we'll kind of discuss that a little bit later and how important it is to be aware of that in your patients and the risk that you could be putting them at by performing PT. Some other causes of the blockage could be fat deposits, air or gas bubbles from deep sea diving. So when we talk about someone getting the bends because they came to the surface too quickly, that's basically what's happening, is they are having gas bubbles that are forming an embolus in their blood vessels, their bloodstream, that is causing a blockage. It can also be from pieces of bone or bone marrow as a result of major trauma. So if they break their leg, they could have bone marrow or pieces of bone fragments that get lodged and cause an embolus. What are the typical signs and symptoms? So pleural pain due to the irritation from the infarcted area is a common symptom. And the pleura, as we know, is the tissue that surrounds the lungs, so they'd just be kind of feeling pain there. Pain in the posterior lower leg or the hip because of that lower extremity embolus. And this pain is generally noted as being more intense and different than the pain that they normally would be feeling just post-surgery or from an injury. So if they've been feeling, just kind of a little bit of pain as they're recovering after a surgery or from a broken bone, but then all of a sudden they're feeling an intense pain, then we know that there's maybe something going on there and they could have an embolus. Dyspnea, seizures, and fever are also common signs and symptoms as well. What are the most effective pain management strategies, or just management strategies? Bed rest, anticoagulants, and supportive care are the three main management strategies. So bed rest, because you don't want to get them up and moving around and possibly dislodge that embolus. Anticoagulants, that blood thinner, can help prevent the embolus from forming in the first place. And then supportive care, if the person is healing from a pulmonary infarction or embolus, then you just want to make sure that you're taking good care of them and that they're not in too much pain. How can this diagnosis be managed in physical therapy? So it's definitely a condition that you want to be careful with. Physical therapy intervention is not indicated for these patients, so if it is known that this patient has an embolus, then you would most likely not be working with that patient, because we want to, like I said, with the bed rest, we want to eliminate any risk of them dislodging that embolus and allowing it to travel to the pulmonary artery. If you're working with a patient for a completely different and unrelated condition and they, as far as you know, don't already have an embolus, if they are suddenly complaining of extreme pain in the leg, that is something that you want to report to your PT and to their physician, because that could be an indication that they have an embolus and that it has just been dislodged, and we would want to make sure that that is taken care of quickly. If the patient has a history of DVT or a history of emboli or a history of pulmonary infarction, those are all things that we want to be aware of so that we know when we're working with that patient that it's a risk, and possibly, discussing that with your PT or with their physician to make sure that that patient is, that you're not going to be further hurting that patient or, making it more difficult for them to heal as quickly and get out of the hospital as quickly as they could be. So yeah, that's all I have for pulmonary embolism and infarction. Thank you for listening.